Are Ontario senior healthcare administrators and executives facing the right level of scrutiny right now? Are they being held to the right level of accountability? Or could we perhaps be asking a bit more of them, pushing back a little bit more on the things that they say? Because right now, they're saying some pretty incredible things to the 14 million people in Ontario. They are saying that society must be shut down, businesses must close, children's schools must be shut, and we must once again suffer all of the increasingly documented harms of lockdowns because they are facing some ICU capacity issues in the hospitals. Now, public health officials, they say they're not particularly worried about double vaccinated persons in their 30s, healthy individuals coming down with COVID-19. That's not a big concern for them. They're not shutting down society because they don't want young, vaccinated, healthy people getting COVID-19. No, what they're concerned about is that if there are many thousands of cases a day, which there are now, that will create a certain number of ICU and hospital admissions that, even though it's a very small percentage, it's actually 0.5% of people, that small percentage, well, that can still go and be a large number that can overwhelm the hospitals, which is why we have to go back into lockdown. And what is that number? Well, back during that press conference, they said it was about 300. Now it's over 400. And I think everyone in Ontario would say, we wish those people well. We wish that there weren't 400 persons in the ICU with COVID-19. But hold on a second. You're saying province of over 14 million people, the whole thing's got to lock down because there are over 400 people in ICU. And some of those very people who are saying, yes, we need the lockdowns, who are at that press conference, they are paid $400,000, $500,000, $600,000 a year to effectively manage the hospital system. It's their job to protect the hospitals. And yet they're saying that your kid has to protect the hospitals and your kid's school must close to protect the hospitals. I'm not sure that actually adds up. And I'm not sure if those people who are paid to protect the hospitals should really be flipping it around on your family and on your kids and saying, no, it's in fact your job. Because here's the thing, Canadian taxpayers have sunk hundreds of billions of dollars into grappling with COVID-19. That's true. Add up all the federal and provincial money that's gone into battling COVID-19. Hundreds of billions of dollars. But 400 people in the ICU, when there are people who are paid $500,000 a year to have innovative ideas, to be creative, because that's what senior executives are paid for, right? That's why you paid the big bucks, because you're able to grapple with big challenges. They in turn are saying, even with these hundreds of billions of dollars that we've got coming on for 2 years, we got to shut down your kid's school again because of 400 people being in an ICU. Does that add up? Or should we maybe question their math and really start calling for more scrutiny and more accountability when it comes to these senior healthcare executives, and calling on the politicians in the Ford government to perhaps start better managing some of these executives who are making arguments that, I don't know, increasingly, they don't make sense, and I'm not sure that the people should tolerate them anymore.